Hello, everyone. My name is Shannon Hardy. I started interning in the Wellness Center in around January. I'm here today to present to you all about mental health. But first, I wanted to ask you guys, did you hear about that man who sued over his missing luggage? He lost his case. Okay, now that the bad joke is out of the way, um, before I start my presentation, I just wanted to say that I know this is not ideal. I would much rather be in person discussing these topics with you guys, but there may be some uncomfortable topics touched on in this presentation, and as much as I would love to be able to discuss, we're just going to have to make do. And with that being said, um, I know you all have a wonderful support system at Carolina Bay, so please talk to Haley about anything you may have questions about regarding this presentation. I hope to see all your bright and shiny faces very soon, and I would love to talk to you guys about anything in this presentation in the future. I really encourage you to take some time to reflect on your thoughts and just when viewing this presentation, be aware of how you're feeling. Please know everyone's journey with mental health is different. So if you happen to reach out and talk to a friend or talk to a loved one about any of these topics, please be kind and intentional with your words to others and to yourself. In light of everything that is going on in the world today, it's important to remind ourselves that everyone experiences everything differently. Everyone may be going through something that you know nothing about. So now more than ever is the time to reach out and show compassion to those that you care about and your loved ones. I would also like to preface this presentation by saying I'm not trying to diagnose anyone with anything or even suggest that you may have poor mental health. I'm just trying to bring attention and awareness to this topic that I believe is really important to well-being. So with that all being said, mental health, breaking the stigma. Let's get into it. How do I? There we go. Okay, so to start off, mental health versus cognitive health. There's a little bit of a difference there. Cognitive health is more refers to your brain health, your brain functioning, if that's different functions like memory, judgment, language. That's not really what we're talking about here. With mental health, we're more focusing on emotional, psychological, social well-being. This is just affecting how we're thinking, how we're feeling, just helping handling stress, relating to others, making healthy choices. So we are talking about mental health, more feelings and emotions side, not cognitive health, although that is also very important. So I'm gonna first walk you guys through two scenarios, one being maybe some problems with your balance. The next scenario is like a sprained ankle. I know I said we're talking about mental health. These are all physical health issues. Just stick with me for a second. So if you think about scenario one, you're experiencing some balancing problems. Maybe think about what you might do, what steps you might take. Scenario two, you have a sprained ankle. Again, maybe what are you thinking? What are you planning on doing? And I'll just talk through some of that with you right now. So with the scenario one of balance, maybe you notice you're struggling with your balance. Maybe it's that annual wellness assessment you don't do as well. So you talk to Haley about how she can help. She tells you about some different balance classes to go to, some different exercise, different ways to improve. Pretty simple. And then if something happens, sprain your ankle, you notice your ankle's hurting, you go to a doctor, they treat your ankle, maybe you have to wear a brace for a few weeks, you put some ice on your ankle, tell your friends you need to rest it for a little bit. So I'm hoping that everyone's thinking kind of along the same lines of these two scenarios. So I want to introduce a third scenario regarding if you were feeling anxious. Maybe if it was about an upcoming event or you're just feeling more anxiety than usual, start thinking through maybe some steps you would take. Would you take any at all? Do you not even worry about anxiety? How you would how those steps would be different. But actually, I think the steps might be a little similar. So if you're experiencing anxiety, same with the balance and the sprained ankle. First, you notice it, you're feeling it, you're recognizing it. Second, you go and talk to someone. So with the balance problem, maybe you talk to Haley. With the sprained ankle, maybe you talk to a doctor. If you're feeling anxiety, maybe you talk to someone you trust about how you're feeling. That can be a loved one, that can be a healthcare professional. And then the third step, what are you doing to treat that? Maybe exercise really helps you out. Maybe you're journaling. Maybe you're practicing breathing techniques. So I like to think whether it's physical health, whether it's mental health, kind of the way we're treating them should look the same. But I know a lot of times in our society, with physical injuries, there's no shame in recognizing maybe pain or limitations. Sometimes there is. I know maybe it might be hard to check in with any physical limitations, but when you think about talking to a doctor, talking to Haley about doing something to improve your physical functioning, it's a lot more welcomed than if you think about mental health. So just my little note down there, as a society, I think we tend to treat mental health a little differently than we treat physical health, but you can't have a healthy mind without a healthy body, and vice versa. You can't have a healthy body without a healthy mind. So just be thinking about all that as we really get into our presentation here. So getting in a little bit more into defining mental health. So maybe what are some things that you think of when I say mental health? So mental health can be defined as, again, our emotional, psychological, social well-being affecting how we think, feel, and act. You might have thought when I said mental health, immediately think of anxiety, depression, bipolar disorder, all these different things. While that does overlap a lot with mental health, that is more so falls under mental illness. So mental illnesses are conditions that affect a person's thinking, feeling, which there's some overlap there, but mental illness is specifically those conditions. Some of them are listed right there: depression, anxiety, bipolar. They can be acute. They might show up and go away. They can be chronic. They can be long lasting. But they will affect your ability to maybe relate and communicate with others and to function each day. So talking a little bit more about mental health and mental illness, while everyone may not have a mental illness, everyone has mental health. I think sometimes there's some gray area of where the line is. Everyone experiences those day-to-day stressors, maybe feeling a little bit of anxiety. Anxiety is not always bad. I maybe have some anxiety about graduating. That's exciting. Anxiety is totally okay. Feeling a little sad now and then, that's okay. That's mental health. All of your emotions, happiness, joy, that's mental health. Mental illness is, again, those conditions. So I've had it explained to me before as like having a cold versus having asthma. Asthma is that chronic condition similar to mental health. And a cold might just be like a bump in the road, which would be your mental health. So having a cold versus having asthma, mental health versus having a mental illness. A mental illness, you might need to have specific treatment plans and work every day, and that's going to look very different for different people. But mental health, everyone has mental health. It's really important to be checking in with yourself and just where you are emotionally, how you're feeling, similarly to how you may check in with yourself physically, like, is anything hurting today? What should I do to resolve that? Maybe you haven't been exercising, you haven't been to the gym in a while, so you're feeling a little more tired. Well, with mental health, maybe I'm feeling a little more agitated today, and that's because I haven't been, journaling or, talking with my friends. So everyone has mental health. It's really important to be checking in with yourself, having maybe like a toolbox of ways to help you when you do experience one of those bumps in the road. Because if you aren't able to check in with yourself and have that plan for what to do when something comes along like a bump in the road, it can make those small things, those small daily stressors feel really big. Having a mental illness is really nothing to be ashamed of. While it might not be something you feel comfortable discussing in a room of people, which is totally understandable, it is something you need to take seriously. Consider talking to a loved one or someone you trust about any like symptoms you're feeling, being completely honest with your healthcare professional. Again, you can't have that healthy body without a healthy mind. So what can cause the poor mental health or even lead to mental illness? There are several factors that can impact mental health. Sorry about that. And it's going to change over your lifetime. So think of mental health like this windy road. There's going to be highs, there's going to be lows, there's twists and turns. And there's many factors. I've listed just 4 on the screen here, but there's many factors that'll affect your mental health time and time again. So first, decline in functional ability, death of a loved one. Obviously, that's going to take a toll on your mental health. And if you're not able to check in with yourself and really be authentic with your feelings, it's going to be pretty difficult to get past these things. Now more than ever, feelings of loneliness and isolation really can take a toll on your mental health. So again, I said you have a great support system at Carolina Bay. If you ever want to talk to Haley or Aaron or Zach, I know they'd be happy to help. You set up FaceTime or navigate any of that stuff, just so maybe that can help connect you with loved ones so you're not feeling as isolated. And then having a limited support group. So there's actually been a lot of research done that shows that you really only need a core group of 5 friends, which maybe sounds like a lot, maybe it doesn't. But if you can just think of 5 people that you would feel comfortable calling if there was any type of adverse like health effects happen to you. I can think of, I'd call my mom, dad, my sister, and a couple best friends I have from college. So just making sure you have that really good support system. Again, it only takes 5. Some biological factors, genes or chemical imbalances. This is where medication can be really, really helpful if you do have a mental illness. It's also something to consider if you or someone you know is going through a tough time with their mental health. Maybe they're just having a bad day, but some people really are just genetically more susceptible, more prone to struggling with their mental health, or maybe even having a mental illness. So just something to think about, like being kind with yourself, being kind to others. But yeah, there are some biological factors that can influence mental health. And then just early adverse life experiences, experience with chronic illness, a lot of stuff that's going to impact your mental health. When I was looking up, I think this was from the National Institute on Aging, they said when the demands placed on a person exceed their resources and coping abilities, their mental health could be impacted. So it's really important, obviously now more than ever, there's a lot of demands being placed on us. So just making sure that we have those resources, we're using our resources and coping abilities, just so your mental health isn't taking too much of a toll. So one of the most prevalent cognitive diseases, I'm sure you're all aware, is dementia. I know we're not talking about cognitive health, but not really considered a traditional mental illness. Dementia does have some similar patterns and is largely impacted by mental health. Also, this could be tied into mental health when you're thinking about if you're worrying yourself about developing dementia, or you are there with a loved one, just watching them go through dementia. There's a lot of ways dementia ties into mental health. So just wanted to touch on that a little bit. So there are different types of dementia, but there are also a lot of different conditions that can present with memory problems and make it look like dementia. But the thing that separates these are once if you have a different condition and it's treated, then those memory problems might go away. So actually, if you're having some mental health problems, that can give you some memory problems, a little bit of confusion. If you have this underlying anxiety, stress, depression, and it's not being treated, it can cause memory problems, a little confusion, like I said. So just these things really go hand in hand, mental health and dementia. Also, like I said, there are different types of dementia. There are also different kinds of depression. So one depression I was looking at is called vascular depression. And this occurs from restricted blood flow. Blood vessels will stiffen and prevent blood from circulating normally, so like specifically in your brain. And so you'll get some of those depressive symptoms. But because of these physiological impacts, this can lead to stroke, and that can actually lead to vascular dementia. So this stuff is really, really connected, really tied in. So it's super important to be aware of your mental health. Another big mental health issue is depression. Before I put up the definition, I just want to maybe you guys just think what triggers might have popped up for you when I put depression down. I'm going to say this like 6 more times, but depression is not a normal sign of aging. It is not a normal thing to go through when you're aging. So the National Institute on Aging defines depression as it's more than just feeling sad. Everyone feels sad, totally normal, that's fine. Depression is a serious mood disorder that requires treatment. So this can severely affect how you feel, think, how you're handling daily activities. Depression is not normal of aging. So with depression, if you're thinking about it as feelings of sadness, loss of interest, the typical signs you might have heard of depression, those are really the symptoms that young adults feel during depression. And maybe not a lot of people know this, but older adults actually have different symptoms when it comes to depression. So feeling tired, trouble sleeping, feeling agitated, and again, confusion or attention problems. These are very generic symptoms, I feel. And a lot of depression is like misdiagnosed or just not diagnosed at all, and can be attributed to just normal signs of aging. But depression, it definitely is not. Every person is unique. You are a unique individual. You know what your normal is. Feeling a little tired one day, maybe because you had a busy day the day before, maybe you're just tired, that's one thing. But if you notice that you are consistently more tired, you are having a lot more trouble sleeping, if you're feeling more agitated than usual and it is repeating, you are your best advocate. So really maybe talk to somebody that you trust, talk to your healthcare professional, and just know that it is not a normal part of aging. It's really important to be honest with your feelings and anything else that might be going on in your life if something out of the ordinary happens. This book that I've put in the corner, Elderhood, I read for one of my classes, and I really, really liked it. It's about this woman, Louise, and she's been a gerontologist for over 20 years, and just her experience in the healthcare industry, and just she uses a lot of like her stories to just describe her time with her patients, and I just thought it was really, really interesting. So you can give that a read if you want. But also really just being honest with yourself and your healthcare provider, even if something, like if you fall, just being honest with them, being honest with the staff at Carolina Bay. I know falls can be scary, but everyone just wants to help and ensure your safety. So please feel open and comfortable talking to your healthcare providers, staff at Carolina Bay, friends, family. Yeah. So well-being, this is all connected with mental health. The little circle here is just different dimensions of well-being. So physical, intellectual, your engagement, your diet, your emotional, spiritual, it's all connected to really get that healthy, full circle well-being. So how does mental health all tie into this? Someone with a physical illness, say you have a heart condition, is more likely to experience depression. I think that all fits. We can all think of that. If you have a serious condition, it's pretty easy to let yourself slip and get into that, get those depressive feelings. So it's really important to recognize that maybe if that is happening, that you're able to reach out and get help. At the same time, it works the other way too. So if somebody has some untreated depression, they are more likely to have negative outcomes with physical conditions. So if you have this untreated depression, you're maybe not taking care of yourself, you're really down. If you do get a heart condition, you're a lot more likely to have some negative health outcomes with that. So some helpful resources for dealing with mental health. I have a picture on the side here of the movie Legally Blonde, where she's talking about exercise giving you endorphins. So endorphins are like a neurotransmitter in your brain, and they're associated with mood and just feeling happy. And when you exercise, those endorphins are released. So also it increases oxygen to your brain, and studies show that exercise can protect against morbidity and depression. So just all around, exercise is a great tool for physical health, but also for mental health. Also I found some studies about pets and how pets can be particularly beneficial when you're going through a major loss or stressor. Just to have that companion. They can also help with executive functioning, just because if you have a pet, like say you have a dog, you're more likely to have to walk the dog and feed the dog and just do these little things that you might not be doing if you didn't have a pet. Also, therapy was a big one. I know that might be a little scary, it might be a little stigmatized, but just like everybody has mental health, it's always beneficial for when you are experiencing those bumps in the roads to have a professional to talk to, someone who will listen to you and help you get through those times. Again, medication, if you have some of those chemical imbalances, maybe you are a little bit more biologically predisposed to mental illness, medication can be wildly beneficial. And then also mindfulness is becoming a big thing, something that I am a big believer in. So what exactly